Welcome to NCLEX over NCLEX, Part 5 of the practice questions of the fundamentals of nursing. Don't forget to pause for more time while reading the questions and rationales. First question. When assessing a client with a nursing diagnosis of fluid volume deficit, the nurse notes that the client's skin over the sternum tense when gently pinched. Which action should the nurse implement? A. Confirm the finding by further assessing the client for jugular vein distension. B. Offer the client high-protein snacks between regularly scheduled mealtimes. C. Continue the planned nursing interventions to restore the client's fluid volume. D. Change the plan of care to include a nursing diagnosis of impaired skin integrity. Answer. C. Rationale. Skin turgor is assessed by pinching the skin and observing for tenting. This finding confirms the diagnosis of fluid volume deficit, so the nurse should continue interventions to restore the client's fluid volume. C. Jugular vein distension, A, is a sign of fluid volume overload. High-protein snacks, B, will not resolve the fluid volume deficit. Changes in the client's skin integrity are not evident. D. Question number 2. Which nursing intervention is most beneficial in reducing the risk of urosepsis in a hospitalized client with an indwelling urinary catheter? A. Ensure that the client's perineal area is cleansed twice a day. B. Maintain accurate documentation of the fluid intake and output. C. Encourage frequent ambulation if allowed or regular turning if on bed rest. D. Obtain a prescription for removal of the catheter as soon as possible. Answer. D. Rationale. The best intervention to reduce the risk for urosepsis, spread of an infectious agent from the urinary tract to systemic circulation, is removal of the urinary catheter as quickly as possible. D. A, B, and C are helpful to reduce the risk of infection, but are of less priority than D in reducing the risk of urosepsis. Question number 3. The nurse assesses an immobile, elderly male client and determines that his blood pressure is 138/60, his temperature is 95.8 F, and his output is 100 milliliters of concentrated urine during the last hour. He has wet-sounding lung sounds and increased respiratory secretions. Based on these assessment findings, what nursing action is most important for the nurse to implement? A. Administer a PRN antihypertensive prescription. B. Provide the client with an additional blanket. C. Encourage additional fluid intake. D. Turn the client Q2H. Answer. D. Rationale. D. Will help to move and drain respiratory secretions and prevent pneumonia from occurring, so this intervention has the highest priority. Older adults often have an increased BP, and a PRN antihypertensive medication is usually prescribed for a BP over 140 systolic and 90 diastolic. A. Older adults often run a lower temperature, particularly in the morning, and B. does not have the priority of D. Even though the client has adequate output, C might be encouraged because the urine is concentrated, but this intervention does not have the priority of D. Question number 4. While caring for a child and mother from Cambodia, what action should the nurse implement to accommodate the client's cultural needs? A. Speak initially with the oldest family member to show respect. B. Realize that Southeast Asians may not take Western medications. C. Ask the husband to step out during the mother's pelvic examination. D. Tell the family that planning healthcare is provided in private with the client. Answer. A. Rationale. Members of the Asian culture have high respect for others, especially those in positions of authority. Extended family members need to be included in the nursing care plan. A. Southeast Asians do not necessarily refuse Western medications. B. Asians also believe that touching strangers is not acceptable, particularly health professionals whom they have not previously known, so the husband should be allowed to remain with his wife during the pelvic exam. C. Provided that the presence of other family members is not harmful to the client's well-being. D. is not correct. Question 5. A nurse is preparing to insert a rectal suppository and observes a small amount of rectal bleeding. What action should the nurse implement? A. Administer the medication as scheduled after assessing the client's vital signs. B. Ask the pharmacist to send an alternate form of the prescribed medication to the unit. C. Withhold the administration of the suppository until contacting the healthcare provider. D. Insert the suppository very gently, being careful not to further injure the rectal mucosa. Answer: C. Rationale. The presence of rectal bleeding is generally a contraindication for the insertion of a rectal suppository, so the nurse should withhold the medication and notify the healthcare provider. C. A and D may cause increased rectal bleeding. Prior to asking the pharmacist for another form of the medication, the nurse must have a new prescription from the healthcare provider. B. Question number 6. In providing care for a terminally ill resident of a long-term care facility, the nurse determines that the resident is exhibiting signs of impending death and has a "do not resuscitate" or DNR status. What intervention should the nurse implement first? A. Request hospice care for the client. B. Report the client's acuity level to the nursing supervisor. C. Notify family members of the client's condition. D. Inform the chaplain that the client's death is imminent. Answer: C. Rationale. The nurse's first priority is to notify the family of the resident's impending death. C. The family may request that hospice care is initiated. A. Reporting the client's acuity level. B. Does not have the priority of informing the family of the client's condition. Once the family is contacted, the nurse can also contact the chaplain. D. Question number 7, our last question. The daughter of an older woman who became depressed following the death of her husband asks, "My mother was always well-adjusted until my father died. Will she tend to be sick from now on?" Which response is best for the nurse to provide? A. She is almost sure to be less able to adapt than before. B. It's highly likely that she will recover and return to her pre-illness state. C. If you can interest her in something besides religion, it will help her stay well. D. Cultural strains contribute to each woman's tendencies for recurrences of depression. Answer: B. Rationale. Analysis of behavior patterns using Erikson's framework can identify age-appropriate or arrested development of normal interpersonal skills. Erikson describes the successful resolution of a developmental crisis in the later years, older than 65 years, to include the achievement of a sense of integrity and fulfillment, wisdom, and a willingness to face one's own mortality and accept the death of others. B. Depression is a component of normal grieving, and A. does not represent susceptible adaptation to the developmental crisis of an older adult, integrity versus despair. C and D are judgmental and not therapeutic. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to click the like button, comment and subscribe.